Of healthcare workers hit the picket line today, protesting working conditions and citing burnout. News 12 New Jersey's Marcy Rubin outside St. Michael's Medical Center right now with more from both sides of the negotiating table. Marcy?
Yeah, Brittany, we know how tough the last few years have been on healthcare workers, the healthcare industry overall, really. And today, nurses and technicians from St. Michael's Medical Center here in Newark took to those picket lines to demand what they say they not only deserve, but what they have earned over the last 2 years on the front lines. Members of Genesso, a union representing about 350 nurses and technicians at St. Michael's Medical Center in Newark, are voluntarily off the job.
We are heroes! We're not zeros!
Instead of caring for patients inside, they are picketing outside, demanding, they say, a new, fair contract.
During the COVID, these people worked very hard. They were there on the front line taking care of the patients in the hospital, and we still would take care of our patients in the hospital.
Nurse Elfrida Johnson is also the local union president. She says after putting patients' lives above their own for more than 2 years, they need more from their employer.
What do we want? Contract! When do we want it? Now!
Their current contract expired May 4th. They want a new one with salaries comparable to other hospital workers in the area. They want better health care coverage and more help on those front lines. Ongoing staff shortages, they say, are stretching those who remain on the job thin. They say even forcing a practice called floating, which assigns nurses where they are needed, not necessarily where they are trained.
When you remove me from my area that I'm supposed to work in and work me in an area that I'm unfamiliar with, it's a little dangerous.
There's a nursing shortage, and getting them to the bedside, I mean, that's all these folks want to do.
Administrators with St. Michael's, which is owned by Prime Healthcare, can't comment, they say, on the ongoing contract negotiations or specific demands. But a spokesperson says they are hopeful an agreement will be reached soon and ensures patients and their families that the hospital is open and operating as safely as it has been for over 150 years.
The hospital remains open and it's fully functional. We have qualified staff that we've brought on starting yesterday, and they're doing a fantastic job.
So, Marcy, exactly how long does a union plan to strike?
Oh, Brittany, they say they will be on the picket line as long as it takes. They hope for an agreement soon, as do hospital administrators, and I have learned that they are back at the negotiating table tomorrow.